Hello, everyone, and welcome to Medicamentum Authentica. I'm your host, Dr. Andrew Kaufman. I have an extra special guest on today. His name is Dr. Grayson Dart. And Dr. Dart is recently finished his family medicine residency after graduating from Midwestern University School of Osteopathic Medicine in Arizona. And he has come to a decision that he does not want to practice mainstream medicine and became interested in natural healing. And so he's here today for me to introduce him to you, my community, and because he's going to be sticking around for a bit, and we'll talk more about that at the end. So welcome to the show, Grayson.
Thank you, Andy. It's a pleasure to be here.
So Grayson, why don't you tell us a little bit about, how you came to the healing professions and what led you to, right after you finish your training, right, and you're ready to fully practice and make a living, to rethink things and pursue knowledge in natural healing and true medicine.
Yeah, it's been quite a journey to get to where I am today. But I would say it all started as a kid. I was quite sick with really bad asthma. My father had asthma, and I grew up and I got kind of the worst of it out of my whole family. Such bad asthma, in fact, that I was basically medicated every night with heavy duty nebulizers, other medicines that I took on a regular basis, inhalers and whatnot. And I experienced multiple hospitalizations too. In fact, some of my earliest memories are me being afraid of the needle that they were trying to stick into my hand. And so
you were traumatized by the health system as a child, it sounds like.
Significantly. And my poor mother, just trying to do the best she could, was taking the advice of the medical doctors and the medical community. Luckily as I grew older, I was able to manage it a little bit easier, but I remained on those medicines well into adulthood. And so I decided at a pivotal moment in my life that I felt like it was time to go into the healing profession. And at the time, I thought that was medicine. I thought that becoming a doctor, I could help other people to heal, and I could become a healer, because that's what I thought doctors did.
Now, Grayson, did you have the thought that, like, if you were the doctor and like dealing with a child like you were back in the day, that maybe you could treat them a little bit differently with respect to, the procedures and stuff? Or did you just kind of, accept that that's the way things are done and you were going to be part of that system?
Well, I think that my insight wasn't quite there, because I wanted really, what I wanted to do was to help kids cure asthma. And I hadn't even thought about myself being cured until really I went into medical school. I was a committed student, did very well, but about my second year in medicine, now that you're asking how would I go about treating them and if I would do it any differently, it was during a pulmonary physiology class where we were learning about asthma and all the treatments according to the severity. And so I asked my professor at the time, is it possible to reverse asthma? Is it possible to cure asthma? And the response was, no, you have to manage it. And so that was kind of the trigger where it just hit me like a ton of bricks.
Isn't that the answer with everything in medicine?
Exactly. No cures allowed, right?
It's a dirty word almost.
Exactly. So it didn't sit well with me. I wanted to be a healer. And I think that was the very first moment where I realized that medicine doesn't heal. It tries to manage, right?
Right.
And so being curious as I am, I think that was the trigger for my quest to find out if other people had healed, to find out if there was a cure for asthma and what other doctors might have been providing that treatment for their patients. And so, without going into too much detail, one thing led to another. And, I don't think I've told you this, Andy, but one of the first holistic practitioners that I started to read from was Kelly Brogan. My best friend was at the University of Miami going to medical school at the time, and she came and gave a lecture. I believe it was 2015. And so he met her, and he met another doctor that has been somewhat of a mentor to me too, Dr. Russell Jaffe. And one thing led to another. And, what I realize now looking back, the paradigms have just continually shifted and changed, but I was so full of toxins. My environment was so toxic. We're talking air fresheners and cleaning products and perfumes and the food I was eating and the water I was drinking and chocolate chip cookies on the regular right before bed. And as soon as I started to clean that up, my symptoms started to go away. And about my third year of medical school, I went off of my drugs completely. And along with that, it's funny because if you look at my weight scale in my third year of medical school, I actually tracked this in an app. I went from 220 down to my high school weight, 180 in about 7 or 8 months without even trying to lose weight. That was not my intention whatsoever, but just cleaning up my lifestyle and getting rid of the garbage and trying to put in the good. Naturally, I just lost that weight. And it's funny looking back at pictures, because I was quite a bit bigger than I am now. But
that's funny.
So
I gained weight in residency.
Oh yeah.
Yes. Because, of the super long hours, and then, you're in the hospital and they don't have any decent quality food in the hospital, of course. The one place where you'd want to give people the cleanest food, right? They have some of the worst.
Some of the worst. No, that's true. And
so wait, I have a question, Grayson, because when you realized that you had this benefit for yourself, did you go back to your professor and say, hey, look, I did these things and I got off my asthma meds? Isn't that amazing? Have you looked into this, right?
So that particular professor, I did not. And I would say the reason why about the same time is when JAMA published the article that medical care is the third leading cause of death in the United States. And so I kind of realized at the time that, wow, my professors, people that are teaching me, my fellow students, their ability to understand where I'm coming from was just not there. So it almost in a way it was, and really at the time too, I was approaching my fourth year of medical school, and that's the time you're supposed to apply for residency. And so I was under a tremendous amount of stress because I had realized that medicine doesn't heal. And so I was just trying to figure out what I was going to do at that time. And so I didn't really go and speak. I did actually confront some other professors because another eye-opening experience, my wife was pregnant with our second child, my son. And this was the end of my second year when he was going to be born. And so I started digging into the hepatitis B vaccine.
Oh, yes.
And speaking of toxins, I actually asked my microbiology professors, do you guys know what's in the hepatitis B vaccine? No one could give me a straight answer.
Wow.
And why would we give that vaccine if supposedly there's this virus that is transmitted through sexual promiscuity and drug use? Why would we give it to a brand new baby?
Right. Or why would we give it to a newborn when they supposedly don't have an immune system until they're a year old?
Yeah.
Right. I mean, they tell us that newborns get their immune system passively from the mother's breast milk, right? Because they don't have the cells yet. So how could they use a vaccine that's supposed to interact with their immune system, right? And, here's an interesting bit of information about that, Grayson, is early on in the COVID pandemic, they, during the lockdown in the United States, they shut down the vaccination clinics. Well, guess what? The cases of SIDS, right, of sudden infant death, practically disappeared during that period of time. And, I've been involved as an expert witness in one case where a father was, accused of smothering their baby and was in jail and ended up suiciding or attempting suicide in jail, I believe. And it turned out in the end that the baby was having a seizure, and because the baby continued to have other seizures, and then they reasoned back, and so they exonerated him, but he was, I believe, paralyzed from a suicide attempt.
Wow.
So, it's like all of the collateral damage that you don't think about that goes from that, and I believe it's really all mostly related to the hepatitis B virus. So what
Mm.
was it like having to go through with, your education and then your actual residency training once you already were questioning so many things?
Yeah. It was, I would be totally honest with you, it was one of the hardest times of my life because in my heart, I knew one thing, but uh, being nervous of, it's a tremendous amount of debt that you get into when you go to medical school, right? And trying to think
Yes.
of how am I going to be employed and how can I be a credible doctor if I don't have, um, my training under my belt or whatever the case might be. And
Right.
so I actually was really hoping to just go do research after medical school and clear my mind and try to figure out what was going on. So my whole fourth year was me doing rotations with a variety of different doctors that most students don't get a chance to rotate with. I did psychiatry rotations, rheumatology rotations, immunology and allergist rotations. And in a way, it was just my thought of, hey, I'm just going to go get as much experience and maybe one of these doctors knows something I don't, And luckily, when push came to shove, a residency spot opened up because one of the students that had taken that spot left for another spot, and I was a great student. I had good grades and test scores, and so it almost just fell in my lap. And I joke with people that I might be one of the only doctors that didn't even apply to a residency program or do a single interview and landed a residency spot because there's medical students that don't even get a chance to do residency their first year. And so, in a way, it almost seemed like divine intervention. And those 3 years of residency were definitely tough. But I had some good advice from another mentor, a doctor here in Utah that I met with before medical school. And I talked with him and he told me, it's a good idea to learn the dark side, but don't join it. And I really feel like that's a huge part of me to understand how the medical system really works. And in family medicine, you're kind of the jack of all trades. Like that's what they tell you, right? You do rotations with
Yes.
all kinds of specialties. So I was able to see inpatient, outpatient surgeries. And so I got a taste of how doctors in a variety of specialties really work, but the outcomes are all not very good, right? Very, very
Well,
expensive without great outcomes.
right. So, Grayson, I really actually think it was probably a pretty good decision overall, even though it may have been difficult and you may have been kind of forced to do some questionable things. But I'm sure that you made a much more conscious and considered decision than any other resident there. But, it puts you in a great position. Like I really, relish the opportunity to work with other kind of conventionally trained physicians because, even though a lot of it is actually incorrect, your knowledge, right? But just having the knowledge of the anatomy and physiology, and much of that is not really accurate either, but it is a great starting point to, investigate things, question things, relearn things, because now you already have like this, degree of expertise in the mainstream position. And there is some truth, right? Because I mean, anatomy is anatomy, right? The heart is on the left side, right? So it's useful to just have that general understanding. And, simple things you can help debunk or you can help understand, like, the issue about, for example, the disease is related to, being acidic in your body. Like you'll have a much more nuanced understanding of pH in the body
Yeah.
than, a layperson coming to this. So I do think it's a great starting position. And, but, that is really excellent advice because you haven't sold your soul to the devil.
Well, I appreciate that, Andy. And it's funny how we ended up meeting because during the pandemic, I was right smack dab in the middle of my residency, so I could see how hospitals and medicine and taking orders from the governmental bodies on how to go about things and the mask wearing and everything was just so crazy. Really, my paradigm shifted quite a bit with germ theory when I saw that undercover video of Tom Cowan. And so my last year of residency, I met with Tom. He was able to mentor me for that last year, almost biweekly, and just he in a way was almost like a lifeline, because I looked forward to that call so much every week, just to stay afloat and finish.
It was like having one attending that you can count on.
Exactly. And so he was able to kind of debunk a lot of things I had been learning, and help me to learn how the body really truly works, and how disease really works. And it's just so fascinating how simple it really is when you get out of the allopathic model and into the natural healing model. And what's interesting is that I did training in osteopathic medicine. So I did the same exact medical school as allopathic doctors, but additionally, we did some manipulation. And the manipulation is actually very holistic. I know countless people who've experienced tremendous healings from osteopathic care.
Well, listen, we're going to have you look into the work of Harvey Bigelsen. Because, we've collaborated with the Bigelsen brothers and, about the holistic blood, but actually Harvey Bigelsen was also an osteopathic physician, came from that background, and he integrated it in with other natural healing modalities, like based on terrain theory and detoxification. So I think that would be a great, obviously you'd have to work with someone in person to use that modality. So there are limitations, but I think that is very, very useful. And so we'll definitely get you in touch with the Bigelsons to talk about that.
Yeah.
But I want to just ask, so you finished the residency last July, and then you're kind of, faced with this situation, right? Where I'm sure that there are plenty of job offers coming forth, or you could start your own regular practice, but you decided to go a different route. So like, how did you make that decision? And then how did you feel once you made that decision?
Yeah, that was, once I graduated, I knew deep down I could not join a regular practice. I'd be doing the same old thing of prescribing medications and vaccinating and doing what I believe to be harm for the most part for people. And so once I was done, it was, I'm going to set up my own practice. And one thing led to another. I was able to get a part-time gig doing disability exams, which to me, I have no problem doing, because some people are disabled for a variety of reasons. And I've learned doing that sometimes medical care is the reason they're disabled in the first place. I can't tell you how many surgeries I've seen gone bad, and medication side effects and different things that really disable a lot of people. So that was one way to just continue to make money. But I tried to set up my practice, and without really knowing, I took some advice from other doctors and just went down the regular old path of get a business license, get licensed as a doctor. I did get my board certification as well. And there was just something about doing all of that didn't really mesh for me. And so when I saw your website and I saw that you actually help people and help doctors to learn how to practice ethical medicine, I figured, hey, this might be a great opportunity for me to know how to really set up my clinic. And when we chatted, I wasn't expecting what you were going to tell me, because the first question you asked me was, why did you get a business license? And I just decided to do it. And, once you had let me know, with businesses, they're going to require masks and they can track you and so on and so forth. And after we talked, it took me a few weeks. I was a little bit, at the time, I was a little sad because I'd been working so hard to get my clinic set up that now I had to revamp and change up the way I was thinking. But once I made the decision, and that decision came from the heart, it was like a tremendous amount of weight off my shoulders, because I now know through your tutelage how to protect myself and how to give people real, true advice that I know will help them to heal without worrying about legal action or disciplinary action from the board and different things like that. So,
Right. Well, so let me just tell the audience a little bit about, the model that we have here because, when you practice as a licensed physician or you have a business license, you have an agreement with the state that you're going to do what they want you to do and they're going to allow you to, essentially break the law if you're practicing medicine, right? Because you can give people poison and you can cut people open, whereas those would be illegal, right? Without that agreement with the state. And if we're going to do, help people learn the real natural healing methods that can result in a complete cure or a restoration of health, we're not working in that, licensing model where we have to provide the standard of care, which is prescription drugs, right, and surgery and radiation, and there are really no other choices. Even nutrition is not really part of that, although you wouldn't get in trouble for just giving nutritional counseling. But so it's like if you don't want to be part of that model, then you have to be in a different realm. And so, this is what I think is one of the best solutions is just moving into the private realm as a private membership club or association or a private health association. And there are different designations and ways to go about this. But essentially, where, what I do in my consultation model is, and, I'm going to talk about Grayson being exposed to this, but I educate people. Like they, tell me about their health concerns and we try to figure out what are the likely, root causes, because that is really the key, to reversing illness is to finding what's the root cause. And then I teach various ways that they could go about, resolving that root problem, that they could help their body correct it. And really, our bodies are self-healing machines. So what we have to do mostly is get out of the way or support what our body's trying to do rather than, there's no cures for anything. There's not like a plant that's a cure or a food that's a cure or anything like that. It's really the body cures itself. And so it's really like an educational service because, my belief about healing and about medicine is that once you have the knowledge of how to restore and maintain health, then you do it on your own and you embody the healing. And then you don't, you're not dependent on ongoing services. So it's a bad business model, Grayson. I'm sorry to tell you, because, keeping people sick and just managing their disease, that's a great business model. It's a subscription model, right? You keep paying over time. And so what I'm going to kind of announce to everyone is that Grayson is going to come on board as a sort of apprentice. And I've developed an educational kind of program or certification, if you will, to help, retrain conventional physicians about natural healing methods and science. And so Grayson has had an experience several days where he has observed this consultations, on the days that I do these. And so Grayson, what was your experience? And, I'm not looking for any accolades here, but, like just kind of, hearing the kind of education, the kind of model, and then what people's responses are and such like that. What was that like for you, contrasted with your residency or other experiences?
Yeah, during residency, it's how well can a doctor follow the rules of the standard of care. That's basically what I was taught to do. So the doctor almost has no ability to freely think for themselves and get to the root cause of a person's problem because it's, okay, here's XYZ criteria. Here's what the standard of care tells you. But working with you and seeing how you react and interact with your clients, it's really getting down to their individual story and what's going on in their particular life. No two consultations are the same. What I've noticed too is what people think is the problem. Many times it truly won't be because, they think it's a neurological disorder that's the problem, but at the end of the day, it's a toxin or alcohol poisoning or something of that nature. And so it's just really fascinating to see how you interact with people and ask them questions and basically get them to realize what the true root problem is. And then once they understand that, it's real easy to go over, okay, here's the things you need to remove and here's the things you need to add. And 9 times out of 10, it's deals with toxins that have accumulated over time and are causing issues. And many times there's a psychological component to it as well. And
Yes, the
re-education on
surprise
how to
psych
live.
consult, right? How many times have we
Yeah,
seen that happen?
I've seen that a lot. And so it's really amazing because for me, now that I understand, and the other thing too that I'll let the listeners know is that I've been practicing these things on myself. So I know what it's like to be addicted to processed food and then to change that. I know what it's like to be dehydrated and finally feel the benefits of being hydrated, and doing cleansing protocols and adding, cleansing solvents and different things like that. And so basically, as I've watched you do it, I've put that into practice in my own life. And I got to tell you, I feel better right now than I think I have basically my entire life, physically, emotionally. Because with healing too, there's always a mental, a spiritual, and a physical component to it, right? And so I've gone
Yes.
through, uh, and sometimes it's a little bit painful to grow, but it's so much worth it once you get to the other side.
So, that's the exact kind of attitude that, will make a fantastic contribution to, this future really of a paradigm shift in healing. And, let me let everyone know that, of course, I vetted Grayson out pretty carefully. And, he got the blessing from Dr. Cowan, which was the first hurdle. And then he also accepted some contrary information from me and reintegrated it really well. And then over time, when we have a little bit of discussion, after we work with a client, for example, and I know that he gets it. He really understands the overall concept of how to approach that. He shows a real desire to improve his skills and knowledge. He's taken it upon himself to, do extra productive work that's not required or that's above and beyond, what he's asked of. So, I feel fully confident, Grayson, to bring you on, as a junior colleague, and that, even if it were my family member who are having a problem, that you'd be able to work with them and teach them the right information. So it's really a pleasure that we have a chance to, have this discussion. And for me, it's actually a real treat to have an opportunity to, mentor someone with a very bright future like yourself, in this arena, because, this is the way that we can enact our freedom and our individual authority, with respect to health going future, in the future and going forward. Because we're at a crossroads, and you can see that the current system is crumbling. And in fact, with the recent Supreme Court decision, where while they triumphantly cut down OSHA's requirement and said that it is not constitutional, they allowed the requirement for healthcare workers to be vaccinated to stand. And I think part of that is to get those workers to quit so that they can then move in the technology, the AI type of system, which we see coming because, and Grayson, I'm sure you're exposed to this, that the electronic medical health record systems, right, that were in place that you had to use, as you said, right, you have to follow the standard of care as closely as possible. And they have now clinical practice guidelines and algorithms and menus, right, that you can't just get a piece of paper and write down what you think about the patient and then write down, your assessment and plan. You have to, if you put in a certain term, it's going to pop up. Did you order this test? Right? Consider prescribing this drug. Right? And if you keep clicking no to those things, well, what's going to happen? It's going to red flag you. Right? Mm-hmm. And then you're going to get marched down to somebody's office and they're going to say, hey, why aren't you following the hospital's protocols? Mm-hmm. And, it's like that. And so once they get over a hump, they can just basically have computer programs do most of this work and have just a few specialists for the most complicated situations, right? And we'll get cut out of that system anyway. So,
Yeah.
Now is the perfect time, any other miserable and frustrated physicians out there who want to take a step in the right direction, this is something that we're developing. We're developing curriculum. Grayson is going to be involved in doing a project, and he's going to be involved in doing some webinars with people as well. So, this is this kind of thing can definitely happen, and you can be successful doing this. And, Grayson is going to teach the world and all of its physicians that you can actually have a bright future outside of that, antiquated and crumbling system.
Well, I appreciate that, Andy. And as you were talking, one other thing too is if you don't follow the standard of care, then the billing department calls you, and they can't get the money, and the doctors don't get the money either. And so there's a financial incentive on almost everything doctors do. And that's another reason, it's very tempting to come out of your practice and your training and try to get a job that's lucrative to pay off that debt. And they kind of dangle a carrot in front of you.
Yes.
And it's just a kind of a sad way the system is designed. And I really do look forward to breaking out of it and really helping people to truly heal and experience a better life, because that's one of the things that I personally believe is I believe everybody deserves the best. And if the way that medicine is going, I know for a fact is not the best. So I'm looking forward to it.
Absolutely. And, you'll start to see, people use this information and just turn their health situation around. And boy, that's, just something that after going through and practicing regular medicine, you just never see. In fact, that's what really motivated me to go in this direction is I read Kelly's book. We have the similar influences. And then this opportunity just came in front of me to say, hey, let's try using this to, someone who had tried all the conventional treatment for an anxiety problem, but had, no relief. And so I said, hey, let's try it. I'll do it too. Like not, we're not doing this as a doctor patient. This is like friends, I'll give you advice. And we did it, and the anxiety was cured. It's the first time I had ever seen that.
Yeah.
I just, you ask any psychiatrist, oh, how many, cases of anxiety have you cured? Right. And now, of course, I didn't cure it, right? It was her body cured it, but it was through the same kind of principles, that I learned much more about after that. And, you'll see the same thing, like when we get emails from people that say, oh, my ulcerative colitis is gone, or my fibromyalgia is gone, or my migraine headaches are gone, and it's extremely rewarding. And, of course, that doesn't happen with everyone, and it doesn't happen with everyone the first time, but there are so many stories like that it really is possible with almost everyone. If you are willing to put in, the effort to learn about it, and willing to put in the effort to actually get out of your body's way, right? Which Grayson and I, of course, we can't do that for anyone. And so this is a model that requires, personal responsibility. But that's what we want to promote for everything in the future, right? Because when we give away our authority and our responsibility, that's when we give away also our freedom.
Totally. And as I've seen, when people truly heal, it's because they become their own health authority, and we're just acting as a guide. We're just helping to bring the information that's really going to help them, but it's up to them to really put that to practice. And for myself and my own healings, not only has it been asthma, but many other things, I've realized how important a healing attitude is, to be committed to being healthy and being alive and being free instead of the convenience of our world. It's convenient to stop by the fast food restaurant. It's convenient to give a pill and a toxic medicine to take away the symptoms for a moment. But to truly heal, it takes a little bit of commitment and vigor and willpower, I would say. But once you get over the other side, it's not nearly as hard as you think it is. And there's so many amazing things that can happen. And it's so worth it.
That's exactly right. We have to stop accepting, these shortcut solutions to things which aren't really solutions. And of course, the more you put in, the more you get out. And but you get unexpected benefits when you do that, like you mentioned, which is one, things aren't so hard after you make some achievement, and then you feel the pride and the sense of accomplishment that goes along with
Yes.
that. Imagine you solved your health problem. You don't have to exalt any, grandiose other,
Mhm.
any leader or authority or, anyone like us either, because we don't, we're not doing anything unique. We just learn some things through experience, right? And then we pass it on, right? And, well, like everybody has their passion. And so, Grayson and I, we put most of our time into learning this material, right? Where we don't learn about other things, even other important things. But anyone, is capable of doing this and getting the results for themselves. And that's the model that is going to bring a bright future for all of us. So,
Absolutely.
Grayson, thank you so much for taking the time with me today. And everyone out there, please look forward. We'll be making an announcement soon about our inauguration of this new consultation service. I believe we'll be calling it True Medicine Consults. And we'll be bringing Grayson on, and we'll announce his starting date, and we'll be able to sign you right up. So to book an appointment with Grayson, and we're really excited about launching this. So keep your eyes open, and we'll see you next time.
Introducing a powerful dietary supplement, over 1 million years in development. A highly concentrated, complex, natural formula, rich in trace minerals as well as fulvic and humic acids. Mother Nature's ancient elixir for energy, revitalization, and long life. Shiljit Mumio means conqueror of mountains, destroyer of weakness. Take in the nutritional wisdom of the ancient past. Unleash the vibrant, healthy being inside. Become the conqueror.